Hi, my name is Daisha Jodri and I direct the volunteer service in the mental health program in Dartmouth. The mental health program in Dartmouth covers the Nova Scotia Hospital, the East Coast Forensic Hospital, the new Beginnings Clubhouse, and the satellite clinics as well. Volunteer services brings the community into the hospital. Folks in hospital, don't have a whole lot of activity sometimes on the units on the weekends and the evenings. It's important to bring community in. I think engaging a community is very important, for clients' recovery, also to have clients feel a sense of their community, that their community cares about them.
I love coming here and hanging out with the clients. We have a lot of fun together. We do many different activities.
I work a lot with the recreational therapists to do arts and crafts groups, walking groups, games groups, current events groups.
A lot of times we go over to Abbey Lane and we'll do sports groups, which I like. We play floor hockey or basketball. And it's just a good way to be active and hang out.
The reason why I wanted to be a volunteer is because I wanted to make a difference in people's lives.
I think it's important that everyone has someone to talk to and spend time with. I like hanging out with people and I think they enjoy hanging out with me.
The rewards are great. Patients feel that people do care about them. It's somebody to visit them if they're having a bad day. It's somebody to talk to. It's somebody to go for a walk with. Go down the street to Tim's for a coffee. Patients really look forward to their volunteer coming in. It makes people feel they're not forgotten and there is hope for their recovery.
I don't know what my effect is. I hope it's that I'm putting a smile on their faces and brightening up their days.
And it's really nice when people tell you a story that they've appreciated their volunteer. I interviewed somebody last week who was a client at a clinic, and she was praising the volunteer driver that I have attached to that clinic. As a client who lived alone, she had to go for doctor's appointments through her treatment, her chemotherapy treatment, and she actually praised the volunteer. She said he was the one consistent person in her life. He would always show up for appointments for her. So when I hear these kind of stories, it makes me feel good about what I do. Sometimes we do lose sight of the impact that we're having, but it's the small stories that remind me at nighttime when I go home of the impact that I am having, that the volunteer service is having. So that makes me feel good about my job.